Okay, everybody. Next topic for discussion is your red blood cells. So we want to call it by the big boy name, so we're going to call it erythrocyte. Okay. Your erythrocytes, or your red blood cells, which we'll abbreviate as such, have some unique features that make them unusual and different from other types of cells. So we're going to start by talking about their unique features and why those unique features are relevant to their function. We always remember in anatomy and physiology that form is going to follow function. So first off, these are the most numerous of all of your blood cells. So then we think, well, what do you mean by that? Most numerous. When someone has a blood cell count done, you would count the number of red blood cells, different types of white blood cells, and platelets, okay, as part of doing that blood count. Your erythrocyte count should be something in the millions, okay, whereas your white blood cell count would be something in the thousands to maybe 10,000, and then your platelet count would be somewhere in between. Your erythrocyte count is far higher than your white blood cell count or your platelet count. So it is the most numerous of all the formed elements, all the cellular pieces of our blood. Again, these are formed from our hematopoietic stem cell, which is a myeloid stem cell that's located in your red bone marrow. So they have no nucleus, no mitochondria, and I know everybody's nervous now because this is significant, but we'll get to it, okay? They have a lifespan. That lifespan is about 120 days, which is also important, which we'll get to in a second. Erythrocytes contain the protein hemoglobin. And we're going to talk about hemoglobin in a minute, but hemoglobin is a protein that can carry oxygen. So let's get to these two because that's kind of important. When you are taught cell structure in A&P1, one of the first things that's top of mind, you learn the nucleus. This is the master controller of the cell. It's in charge of everything. And now I'm telling you, you have a cell in your body that has no nucleus. Why is that significant? No mitochondria. Why is that significant? All right, so first let's talk about why the nucleus is absent. There's no room. There's not enough room for a nucleus because the protein hemoglobin is quite large, and we'd rather have more hemoglobin, so we're just going to push the nucleus out of there. No nucleus. But because of that, the cell cannot undergo mitosis. It cannot divide and give you a new cell. So that's why erythrocytes have a definable lifespan. So they are formed, they survive about 120 days, and then they're broken down. And we'll get to the breakdown piece in a second. No mitochondria. Why is that significant? Back in A&P1, when you learned the parts of the cell and you talked about the mitochondria, you learned that the mitochondria was the site where ATP was produced. And so now we think to ourselves, but if there's no mitochondria, what does that mean, no ATP? Well, a cell can't survive without ATP, so we can't have that. So we need to get around. The get around here, no mitochondria means we're going to do anaerobic respiration. You're going to produce ATP, but you're going to do so without oxygen, okay? We can do that by simply doing something like glycolysis, which does not require oxygen and is a form of anaerobic respiration, but will certainly provide ATP to keep the red blood cell going. And so that's how it works. And it makes sense if you think about it for more than a second. Remember, the job of the erythrocytes is really to carry oxygen. You don't want them using the oxygen they're supposed to be carrying. That wouldn't make much sense. So by using anaerobic respiration, they'll simply carry the oxygen but won't use oxygen to produce their own ATP. Okay, so let's get into why hemoglobin is important. And we'll talk about the shape of the red blood cell. Okay, so first off, the shape. The shape of the red blood cell is a biconcave disc. So that means the outer rim is a little bit thicker and then it's kind of thinner in the center. This gives it a very high surface area to volume ratio, which means you're going to get a huge surface area and a fairly conserved amount of space. This is important, again, because of the size of hemoglobin. We want to be able to fit multiple copies of the protein on a single red blood cell, okay? Hemoglobin is a large protein. So when we were talking about some of our hormones, some of those were only a few amino acids, right? You had things that were 29 amino acids. They were fairly tiny. Hemoglobin is large. It has 4 subunits. So we have these 4 protein subunits that have to be formed and then brought together. And then in that, we also have iron present as well. So iron is required for the production of hemoglobin and is therefore required as part of the process of your red blood cells carrying oxygen. Each of the 4 subunits is able to bind 1 molecule of oxygen. So when you get down to it, each hemoglobin can carry 4 molecules of oxygen. That gives you a very large carrying capacity for each hemoglobin molecule, and then for each red blood cell, because if we think about if we had many copies of hemoglobin on a single red blood cell, each of them able to carry 4 oxygen molecules, you're really getting a lot of your bang for your buck in terms of an oxygen carrying capacity. Now, excuse me. Now, because the red blood cells don't copy themselves and don't go through mitosis, we have to have a mechanism to break them down and potentially reuse some of the parts. So, all right, so when we talk about red blood cell breakdown, you've got that iron piece, and some of that iron can be recycled. But then we have to deal with the rest of the pieces of hemoglobin that need to be broken down. That's going to be carried out by 2 organs, your spleen, and then your liver kind of finishes the job. One of the products that's produced as part of red blood cell breakdown will be structures called bilirubins. The liver is going to process these bilirubins to form a substance called bile, which is then used for digestion. So your liver produces the bile and then it's stored in your gallbladder. And if you've ever seen the gallbladder of an animal, the gallbladder is kind of like a dark green. That's because the bile is pretty concentrated inside of your gallbladder. If you took a drop of bile and put it on a white piece of paper and just smeared it, you would see that it's kind of like a yellowy green color. Why am I telling you this? Because the bilirubins are part of the bile that give it its color. So if the liver is not functioning properly, these will back up in your bloodstream. How do I know that? You have a condition called jaundice. When someone becomes jaundiced, their skin and the whites of their eyes and their nail beds turn yellowish. That indicates to me that there's dysfunction with the liver. You can also have bilirubins spill over into your urine stream if this occurs. So not just you would be jaundiced, but your urine would turn almost the color of like steeped tea, almost like a brown color, okay? Why the liver is not functioning properly, that we'll kind of talk about when we do the digestive system. But jaundice is a symptom that there's an issue with liver function, okay? All right. So let's talk about some issues associated with red blood cells, okay? First of all, I'm just going to cover this from kind of a 30,000 feet perspective first. So let's talk about anemia. Okay, on paper, anemia means, by definition, that you have a reduction in your oxygen carrying capacity. So again, this is a broad definition on purpose, and that's okay, but we want to try to drill down why you have a reduction in your oxygen carrying capacity. So there are different types of anemias. I'm not going to highlight all the types. I'm going to highlight just a few. Some that I would call easy fixes because they're dietary in nature. One that is genetic, and then one that's kind of very out of the box. So all of them have in common that there's been a reduction in your body's ability to carry oxygen. And then we think about, well, how would you know that this has occurred? Well, obviously, if you're not carrying enough oxygen, you're not producing enough ATP, you're not getting enough energy. So you would have fatigue. Okay, that is going to be a sign and symptom associated with anemia. You might also have a change in pallor. Someone's appearance might appear blanched or pale, but fatigue is kind of a key symptom associated with anemia and something that a patient would notice, right? All right, so let's talk about how you can have a reduction in oxygen carrying capacity. So first I'm going to start off with things that are dietary in nature. So two that come to mind, the first one is IDA, and the second one is pernicious anemia. IDA stands for iron deficiency anemia. This is probably the most common cause for anemia worldwide, especially in areas where you might have extensive malnutrition, that people are not getting enough iron in their diet. So this is coming from inadequate iron in the diet. Okay, so you have certain foods that are good resources of iron, but if people don't have access to those foods or don't eat them and don't take any supplements of iron, they could be iron deficient and therefore anemic. Why? If you don't have enough iron, you can't produce enough hemoglobin, and if you can't produce enough hemoglobin, you're certainly going to feel anemic. Pernicious anemia means you have a reduction in certain B vitamins. Things like B6 and B12. Pernicious anemia, again, is usually due to a decrease or a drop off in B vitamins that's dietary in nature. Because B vitamins are critical for the production of genetic material and for cell division, and remember, those stem cells really need to keep dividing continually to provide a resource for producing our red blood cells. Someone who is deficient in B vitamins would have pernicious anemia. Now, obviously, because these are dietary in nature, where possible, to correct for these types of anemia, you would simply either take iron if it's IDA or take B vitamins if it's pernicious anemia. Within a couple of weeks of putting the appropriate amount of these items back into your diet, you should feel relief from anemia. Okay, so the next type of anemia that I'm going to talk about is something genetic in nature, and that's sickle cell anemia. So just a few minutes ago, I was saying that the shape of your red blood cell is a biconcave disc. Sickle cell anemia, again, the patients are anemic because their oxygen carrying capacity is reduced, but this is not dietary in nature, this is genetic. People who are sickle cell patients have a faulty gene which leads to the production of abnormal hemoglobin. HB is the abbreviation for hemoglobin. Patients who have abnormal hemoglobin, because the hemoglobin is not shaped correctly because of the recessive genes associated with sickle cell anemia, it winds up kinking the shape of the red blood cell. So rather than it be shaped like a nice biconcave disc, it's shaped like a sickle. Okay, the change in shape of the red blood cell then compromises this particular type of red blood cell from carrying the appropriate amount of oxygen, which is why the patient is anemic. The abnormal hemoglobin, remember, hemoglobin has 4 subunits. It's just one of the subunits that's abnormal in a patient that has sickle cell anemia. So what does this mean in terms of outcomes? Well, obviously your patient is going to be extremely fatigued because they are anemic. But there's other outcomes associated with sickle cell anemia purely due to the shape of the red blood cell. And then, of course, we have to consider breakdown of this unusually shaped red blood cell and how that could affect organs that are required for us to break down our red blood cells. So, other signs and symptoms: chronic widespread pain, sometimes damage to both the spleen and the liver. And again, associated with liver damage, your patient would be jaundiced, especially when they're in crisis. This is a big problem. Patients who have sickle cell anemia are often in chronic widespread pain, again because of the shape of the red blood cell. As you're moving through the circulatory system into those capillary beds where you have oftentimes just one cell going through at a time, the shape of this cell doesn't lend itself to having the cells pass through the capillary beds very easily, and because of that can cause chronic widespread pain in a sickle cell patient. Damage to the spleen and the liver, because the spleen and the liver are heavily involved, obviously, in the breakdown of red blood cells. When you're breaking down the blood cell that's not shaped appropriately, it could cause damage to both your spleen, which remember is very loose reticular connective tissue, can be removed. The liver will pick up the slack and complete the whole process of the red blood cell breakdown. But sometimes people can incur some damage or dysfunction associated with the liver, and then that would lead your patient to be jaundiced as well. And so you get that yellowing of the skin. And again, depending on the tone of someone's skin, you might not notice the jaundicing as clearly, but you would certainly notice it in the whites of their eyes. Okay, there's no cure for sickle cell anemia. You can treat sickle cell anemia with blood transfusion, obviously, because red blood cells cannot go through the process of mitosis and only have a finite lifespan. You would have to transfuse every few months to make sure that your patient was not in significant discomfort. So, how is the pain managed? Oftentimes with opiates. And because we're managing pain with opiates, there are certainly a lot of pitfalls associated with that. Oftentimes patients are put on opiates at perhaps not the appropriate dose or for an extended period of time with no real mechanism of how to manage the opiates and manage the side effects associated with opiates. And so that becomes a pain management problem and is oftentimes a source of addiction in patients who are treated for sickle cell anemia. Okay, and then the last type of anemia, which is one that's kind of just out of the box, it's called aplastic anemia. This is a type of anemia that occurs when you have damage to the stem cells. Because the stem cell line is compromised, it's then going to impact your ability to make red blood cells, white blood cells, and platelets. How the damage or the compromise to the stem cells happen can be any number of ways. Can happen through exposure to ionizing radiation, can happen as a result of age in some patients, or can happen with exposure to certain types of medications and certain drugs. The bottom line is this person will be anemic because they're not producing enough red blood cells, but they would also theoretically not produce enough white blood cells and enough platelets. So they would have issues downstream of that associated with infection and with blood clotting. The treatment for aplastic anemia is you need a bone marrow transplant. So that we could impart healthier stem cells, and then hopefully the process downstream of that would be corrected as well. Okay, that's going to do it for red blood cells, guys. I'll be back with white blood cells.